एउटा पनि न्यूक्लियस थाहा छैन vagus nerve को? One nucleus is there in the floor of the fourth ventricle.
Dorsal nucleus.
That is known as the dorsal nucleus of vagus. Next one is we have got the can see the nucleus of tractus solitarius. So can you name the nerve which is forming the nucleus of the tractus solitarius? There are mainly the three nerves.
7, 9, 10.
9, 10. So 7, 9, 10 combinedly, those will have the combined nucleus that is known as the nucleus of tractus solitarius. And this nucleus of tractus solitarius is receiving the taste sensation. So it is receiving the special sensation from the tongue. So the functional component of this will be receiving भनेपछि the afferent. Oh, this is the sensory one is afferent. It is receiving the special sensation. So this is the what is special visceral afferent. So this is a special visceral afferent. Now next one is we have got the another motor nucleus. Deep, it is present in the deeper part of the medulla oblongata. So this is the nucleus ambiguous, and you know the nucleus ambiguous is mainly formed by the three cranial nerve. What are those?
9, 10, 11.
9, 10, 11 will have the combined nucleus that is known as nucleus ambiguous, and the nucleus ambiguous is going to innervate. के गर्छ the nucleus ambiguous ले केलाई innervate गर्छ? It will innervate the muscles which are derived from the pharyngeal arches. So what will be the functional component?
Special visceral efferent.
Special visceral efferent. Now the last one is the spinal nucleus of the trigeminal nerve. Now see over here, this is the spinal nucleus of the trigeminal nerve, and over here this is the sensory one, the sensory, because it is receiving the fiber from the vagus nerve. Now you can see over here, can you see the vagus nerve? Some fiber of the vagus nerve is going and ending in the spinal nucleus of the trigeminal nerve. That means this part of the vagus nerve is receiving the general sensation from the viscera, and finally terminating this into the spinal nucleus of the trigeminal nerve. So for that purpose, we include the spinal nucleus of the trigeminal nerve in a nuclear origin of the vagus as well. But if you don't want to include the spinal nucleus of the trigeminal nerve, it will be fine. But what you have to do is you have to remember the nucleus ambiguous, dorsal nucleus of the vagus, nucleus of the tractus solitarius. Those are the very important nucleus. Now next, so this one is the same thing. You can see over here, this is the dorsal nucleus of the vagus, this one is the nucleus of the tractus solitarius, and you can see the long nucleus of the trigeminal nerve. This one is the spinal, this one is the mesencephalic. So over here, this is spinal we include the spinal nucleus of the trigeminal nerve. Next one, we have the nucleus ambiguous. So remember, the first thing is you have to remember the nucleus, and it will be easy for you to mention the functional component. Now same, I've already told you the nucleus ambiguous, special visceral efferent, dorsal nucleus the vagus parasympathetic outflow, general visceral efferent, tractus solitarius, special visceral afferent. Now this one is the spinal nucleus of the trigeminal nerve. We have the general somatic afferent, and this is receiving the pain, temperature sensation from the GIT part, from the tongue, from the ear, from the tympanic membrane. So it is receiving. So we include the spinal nucleus of the trigeminal nerve over here also. Is it clear this one? Now will you be able to mention the functional component of the vagus nerve in your exam?
Yes, ma'am.
Okay, I'll move to the next slide then. Now next, from the superficial origin. Now I think you have already learned about this one. This is the brainstem, midbrain, pons, medulla oblongata. This one is the pyramid. This one is the olive, and behind the olive we have got the posterolateral sulcus. So it will emerge out from the posterolateral sulcus between the olive and infracerebral peduncle below the glossopharyngeal nerve, that is the vagus one. So you can see the vagus one over here. This is the accessory and this one is the hypoglossal. This is how it will come out from the brain. Now this one is the review for you. You just read by yourself. This one is the overall summary of the functional component, their nuclei, location, distribution, and the functions. Now, talking about the course of the vagus nerve, when it come out from the cranium or when it come out from the brain through the posterolateral sulcus of the medulla oblongata between the olive and the infracerebral peduncle, it will come out. It will enter into the posterior cranial fossa. Then from the posterior cranial fossa, it has to come down or it has to come out of the skull. Now, how it will come out from the skull? It will pass through the intermediate part of the jugular foramen along with other cranial nerve, along with the glossopharyngeal and accessory. So glossopharyngeal, accessory, vagus will come out from the intermediate part of the jugular foramen and it will come out of the skull. Then we can see over here the two ganglia. This one is the superior ganglia and this one is the inferior ganglia of the vagus nerve. Now it will enter into the neck region that is known as the cervical part. In the cervical region, it will descend down. It will become a container of the carotid sheath and run between the internal jugular vein and internal carotid artery. Next, now it will enter into the root of the neck. At the root of the neck, it will enter the thorax through the thoracic inlet. Then we can see over here. Now just see over here. Now at the root of the neck, it will enter into the thoracic cavity through the thoracic inlet. Now how it is going to enter? Now you can see this is the right vagus and this one is the left vagus. Now the right vagus at the root, it will descend down behind the internal jugular vein in front of the right subclavian artery. So right subclavian artery अगाडिपट्टि र internal right internal jugular vein को पछाडिपट्टि the right vagus nerve will run. Then on the left side, it will run between the left common carotid artery and the left subclavian artery. So this is the course in the case of the neck. Now from there, it will enter into the thoracic cavity through the thoracic inlet. Now we'll have the thoracic part. Now in the thoracic part we have the superior mediastinum, and one of the containers of the superior mediastinum is the vagus. We have the right vagus, left vagus. The right vagus will pass posterior to the right brachiocephalic vein and the superior vena cava, whereas on the left side, the left vagus will pass along the left surface of the arch of aorta. See, arch of aorta, left side of the arch of aorta. Then the both will pass behind the hilum of the root of lungs and form the pulmonary plexus. Then it will enter into the abdomen through the esophageal hiatus as a posterior vagal trunk and as a anterior vagal trunk. I'll summarize once again the lower part. Now the right vagus will run posterior to the esophagus and continue downward as a posterior vagal trunk. Whereas the left vagus will run anterior to the esophagus and run as anterior vagal trunk. Now both esophagus, anterior vagal trunk, posterior vagal trunk will pass through the esophageal opening which is present in the diaphragm and enter into the abdomen region. So this is the overall course of the vagus nerve. Now just see, this was the same thing. Now, hello? के सोध्नु पर्ने छ? हेलो
हजुर
के सोध्नु पर्ने छ? तपाईहरु मलाई रेस्पोन्स गर्दै हुनुहुन्छ कि somebody else? Do you have any question? Okay. Now next one is we'll move to the branch of the vagus nerve. See, in the branch of the vagus nerve, the first is we have the branches in the jugular foramen, then jugular foramen over here. Then we'll be having a branch in the neck region. branch in the thoracic cavity and abdominal part. So jugular part, neck region ma bhayo, ani arko bhaneko thoracic part, and next one is the abdominal. Now what are the branches that will arise in the jugular foramen? We have the meningeal branch one. The meningeal branch has not been shown over here. Next one is, can you see the nerve going and innervating the ear? So this is known as the auricular branch. Okay, this is the auricular branch, or we can call it as the Alderman's nerve. So this auricular branch or the Alderman's nerve will innervate the external acoustic meatus and the tympanic membrane. Now in the neck region we have the pharyngeal branch, branch to carotid body, supralaryngeal branch, and right recurrent laryngeal nerve. You have to remember one thing. In the neck region we have the right recurrent laryngeal nerve, but the left recurrent laryngeal nerve will be the branch in the thoracic cavity, because this is working, or this is passing below the arch of aorta and coming above. So this is the branch which is present or which will arise from the vagus in the thoracic part. So we never include the left recurrent laryngeal nerve as a branch in the neck. So branch in the neck ke matlab bhayo pharyngeal, branch to carotid body, supralaryngeal branch, and the right recurrent laryngeal nerve. Now next one is, in the case of the thorax, in the thorax we have with the cardiac branch, we have with the pulmonary branch, we have with the left recurrent branch. So these all are the branches. I'll show you. Okay, this is the Alderman's pharyngeal superior. You see. This one is the thoracic. Left recurrent laryngeal, pulmonary branches, cardiac branches, esophageal branches. These are the branches in the thorax. Now next one is the branches in the abdomen. So in the branches in the abdomen, we have the celiac branches, we have the gastric branches, and we have the hepatic branches. So these are the three branches. I'll show those branches in the diagram. See this one. So in the abdomen region, we have the celiac branch, then we have the gastric branch, and we have the hepatic branch. So these are the three branches in the abdomen. So these are the overall branches of the vagus nerve. I have a PKLS supply code, you just read by yourself, right? So those are the pharyngeal branches. Now you can see the supralaryngeal, cardiac branches, then left recurrent esophageal branches, then vagal trunk. Now you can see over here, this is the right vagus, this one is the left vagus, this is the right recurrent laryngeal nerve, and this one is the left recurrent laryngeal nerve, which is the branch in the thoracic cavity. So this all are the branches of the vagus nerve. Now what is the effect of the unilateral section of the vagus nerve? So whenever there is the unilateral section of the vagus nerve, there will be the unilateral paralysis of the soft palate, and there will be the loss of palatal reflex. Now why is it so? Because the vagus nerve is going to innervate the muscle of the palate. Okay. Now next one is, we have the unilateral paralysis of the pharyngeal muscle and ipsilateral loss of the gag reflex, and next one is the unilateral loss of the pharyngeal sensation. So all the muscle of the palate, pharynx, and larynx, these are supplied by the vagus nerve. Okay. The next one is, the last one is the applied anatomy of the vagus nerve. So the applied anatomy, one of the branches of the vagus nerve is known as the auricular branch, or it is also known as the Alderman's nerve. Now why those auricular nerve are called as the Alderman's nerve? Because previously British Alderman's people, they used to stimulate the auricular branch of the vagus in order to increase the appetite, because this is the auricular branch of vagus nerve which is innervating or which is supplying the external acoustic meatus. External acoustic meatus like supply goes and knob supply, also the tympanic membrane. Now the stimulation of the auricular branch in the external acoustic meatus will result in the increased appetite, and those are mainly performed by the previous British Alderman's people. So that's why for that purpose the name, another name is given as the Alderman's nerve. Now whenever there is the excessive irritation that may cause vomiting, that may increase the heart rate as well. That is also another one. Now next one is, we have the vagotomy. This is selective vagotomy. So mainly, it is mainly done in order to treat the peptic ulcer. So peptic ulcer treat गर्दाखेरि कुनै कुनै branch, particular some branch will be cut off, that is known as a selective vacuotomy. The next, another one is the accessory nerve. Now, if you have any confusion regarding the vagus nerve, then you can ask me. के छ सोध्नु पर्ने vagus nerve मा? Hello? Okay. Now, next one, the 11th cranial nerve is known as the accessory nerve. Now, why the name is given as the accessory? Why the name is given as the accessory? It has been said that accessory nerve is the detached part of the vagus nerve. That's why we call this one as an accessory to vagus nerve. That's why the name is mentioned as accessory nerve. Now this accessory nerve is the 11th cranial nerve, and this is the purely motor. So whatever the functional component will be there in accessory nerve, that is mainly the efferent one. So this accessory nerve is mainly the spinal part of the accessory nerve is the spinal part, the cranial part of the accessory nerve. This is innervating the muscle of the larynx, muscle of the pharynx through vagus. So what will be the functional component for this one?
Special visceral efferent.
That is the special visceral efferent, because this one is 9, 10, 11 nucleus ambiguous. So this is the motor nucleus of accessory nerve. We have the two types. We have the cranial part and the spinal part. The nuclear origin, the cranial part. This is the cranial part, and this one is the spinal part. Now the cranial part is present in the lower part of the nucleus ambiguous. And the spinal part. Now you can see over here, the spinal part is present in the anterior horn of the C1 to C5 spinal segment. So this is the spinal nucleus, and this one is the cranial nucleus of the accessory nerve. That's why we call the accessory nerve consists of mainly the two parts, spinal part and the cranial part. You can see over here, this is the spinal part going above. This is the cranial part which is coming out and finally forming the accessory nerve. Next, this is the cranial part, this is the spinal part, this is the special visceral efferent, nucleus ambiguous. The spinal part is present in the anterior horn of the spinal cord of C1 to C5 segment. Then it will exit out through the jugular foramen both. Then it will supply, the cranial part will supply the muscle of the soft palate, muscle of the pharynx, muscle of the larynx through vagus. Right? Now next, the spinal part will innervate the two muscles, sternocleidomastoid and the trapezius. Now I'll move to the course of the cranial part. Now just see over here, just focus on the cranial part. This is the nucleus ambiguous, the lower part of the nucleus ambiguous, which will give rise to the cranial part of the vagus nerve. Then it will come out from the posterolateral sulcus of medulla oblongata. Medulla oblongata posterolateral sulcus below the vagus nerve. That is the exit point for the accessory nerve. Then it will enter into the posterior cranial fossa. Now what will happen in the posterior cranial fossa? Can you see the green one? This is the spinal part. This is the green one, the spinal part. This is the cranial part. The both will get joined, or both will get unite in the posterior cranial fossa, and after joining with the spinal root, it will come out through the cranium, through the jugular foramen. So jugular foramen, but both part will come out. Now the cranial root. Now this black is the cranial root. Now the cranial root will finally attach to the inferior ganglia of the vagus nerve. That's why this is the cranial part of the accessory nerve, which will end by attaching with the vagus nerve. So whatever the muscle will be supplied by the accessory nerve, this is mainly through the vagus nerve, because this is finally ending in the vagus nerve. Is it clear, this one? And the cranial root of accessory nerve will attach to the inferior ganglia of the vagus nerve. त्यही भएर यो हामीले तल ट्रेस गर्यो भने भेटिँदैन है, accessory cranial part of accessory nerve हामीले भेटिँदैन, because it has been terminated into the vagus. That's why अब अरू चिजहरू नर्भ सप्लाईहरू पर्दाखेरि through accessory cranial part of accessory through vagus भनिन्छ नि. That is the main thing. Okay. Is it clear, this one?
Yes, ma'am.
Now next, now this cranial part of accessory nerve will innervate the pharyngeal muscle, innervate the pharyngeal muscles, innervate the muscle of the soft palate and the larynx through vagus. Okay. Now next one is, let's see the spinal part of the accessory nerve. Now the spinal part of the accessory nerve will, the nuclear version, the nuclear version is present in the anterior gray horn of spinal cord from C1 to C5 segment. Now from there, the superficial version, it will emerge out from the spinal cord between the ventral and the dorsal rami of between the ventral and the dorsal root of upper 5 cervical nerve into the vertebral canal. Then after that, it will ascend up. It will enter the cranial cavity through the foramen magnum. Then in a posterior cranial fossa, it will join with the cranial root of accessory nerve. Now finally, both the cranial root and spinal root, the combined one, will exit out through the cranium through the jugular foramen. Then the cranial root के भयो inferior ganglia the vagus मा गयो terminate भयो, whereas the spinal part of accessory nerve, this is the spinal part of accessory nerve will get separate from the cranial part. Then it will pass in front of the tip of the atlas. It will pass deep to the styloid process, deep to the stylohyoid and posterior belly of digastric. Then it will be related with to the anterior border of the sternocleidomastoid mastoid muscle at the junction of upper 1/3 and lower 2/3. Your upper 1/3 boyo, your lower 2/3 boyo. So somewhere over here it will be related. Then it will pierce the sternocleidomastoid muscle. It will supply the sternocleidomastoid muscle. Then it will become the content of the posterior triangle, and finally it will terminate by innervating the trapezius muscle. That's why the spinal part of the accessory nerve will innervate the two different muscle of the neck region. One is the sternocleidomastoid muscle. Next one is the trapezius muscle. These are the two muscles which are innervated by spinal part of accessory nerve. So this is overall course of the spinal part. You can see, so after emerging out from the jugular foramen, you can see the relation, sternocleidomastoid muscle, then trapezius. This is the posterior triangle of neck. Now, what are the branches? The branches in the cranial part is the pharyngeal branches, recurrent laryngeal branches, cardiac branches. Those are the cranial part. Now, in the spinal part, we do not have the particular branches. It will just supply the two muscle, sternocleidomastoid and the trapezius. So these are the exception. All the muscle of the soft palate will be supplied by the cranial part of the accessory nerve except the tensor veli palatine. No, so those are the exception. You minus correct exception away. So next is the applied anatomy of the accessory nerve. So applied anatomy of the accessory nerve. Whenever there is the irritation of the spinal part of the accessory nerve, that will lead to the torticollis. Torticollis भनेको spasmodic contraction of the sternocleidomastoid muscle and the trapezius. So यो sternocleidomastoid muscle र trapezius को contraction भयो भने, painful contraction भयो भने, that is known as a torticollis. Now, the injury may be possible during the surgery. The injury to the accessory nerve may be during the surgery, maybe penetrating injury of the neck muscle paralysis. Now you can see over here, there is the pus accumulation near the middle of the sternocleidomastoid muscle. So whenever there is the pus accumulation near the middle of the sternocleidomastoid muscle due to the inflammation of the superficial cervical lymph node, then you have to be very you have to be very cautious in order to give the incision. So incision you have to incise across the sternocleidomastoid muscle, because this accessory nerve is related to the posterior border of sternocleidomastoid muscle. Oh, posterior border of sternocleidomastoid muscle. You can see this nerve? This is related to this part. So what you have to do is you have to give the incision across the sternocleidomastoid muscle, not along the posterior border. Next one, the deformity of the neck due to the shortening of the sternocleidomastoid muscle is known as the wry neck. This is the congenital anomaly. So when you have the shortening of the sternocleidomastoid muscle. Now the last one is the hypoglossal nerve. Before entering into the hypoglossal nerve, if you have any confusion about the accessory nerve, then you can ask me. Vivian, do you have any queries about the accessory nerve? Isa सोध्नुपर्ने accessory nerve मा Okay. Now next one is the hypoglossal. This is the last cranial nerve, right? This one is the last class of the cranial nerve. Now the hypoglossal nerve is the last cranial nerve. It is the motor, sensory, or the mixed one. Which one is this? Hypoglossal.
Motor.
It is purely motor. So what is the muscle which is supplied by the hypoglossal?
Muscles of tongue.
It is mainly supplying the muscle of the tongue. Now, what will be the functional component for this one?
Somatic efferent.
That is the somatic efferent, because these are the skeletal muscle of somatic origin. So hypoglossal nerve. So we have the deep origin, that is the nuclear origin. Next one is the superficial origin. Our nuclear origin, when in the previous practical class, I have drawn the floor of the fourth ventricle. So in the floor of the fourth ventricle, over there, hypoglossal trigon भनेर पढ्यो नि हैन? Oh, so medial to the sulcus limiting, we have the hypoglossal trigon. So deep to the hypoglossal trigon, we have the motor nucleus of hypoglossal nerve. So that is the deep origin. Now, what about the superficial origin? The superficial origin is this one. So between the pyramid and olive, this is the anterolateral sulcus. So from here, it will emerge out and enter into the posterior cranial fossa. So motor, hypoglossal nucleus, medulla oblongata in the lower half of the floor of the fourth ventricle, then somatic efferent, anterolateral sulcus of medulla oblongata, superficial origin, hypoglossal canal, that is cranial exit, then distribution, tongue muscle. So this is the overall summary of the hypoglossal nerve. You can see how it exits out through the cranium. Okay, this one. This one is the hypoglossal nerve. This is the hypoglossal canal. So through the hypoglossal canal, it will come out from the cranium. Hello? So what is the course? So when it come out from the hypoglossal canal, it will present deep to 9, 10, 11 cranial nerve, internal jugular vein, and internal carotid artery. Next one is, it will run between internal carotid artery and internal jugular vein. This one. Next one is, then after that, it will present lateral. It will present lateral, or it will cross internal carotid artery, external carotid artery, and the lingual artery. So this is crossing those paths. Now next one, then it will enter into the digastric triangle. It will pass deep to the posterior belly of digastric muscle and the styloid. So this is whatever you can see the cut portion of the muscle. This is the posterior belly of the digastric muscle. And next one, so similar over here we have the styloid. So this one, this is the posterior belly. It is cut portion of the posterior belly of digastric. So deep to the posterior belly of digastric and styloid, the hypoglossal nerve will be running. Then it will lie on a hypoglossal muscle. This is the hypoglossal muscle. It will pass deep to the mylohyoid muscle. This is the mylohyoid muscle. Then it will pierce the genioglossus muscle and supply the all muscle of the tongue, supply the most of the muscles of the tongue, except the palatoglossal. So this is the course of the hypoglossal nerve. Now, what are the branches of the hypoglossal nerve? Now, the communication branches, starting when it come out from the hypoglossal canal, you can see the communication branches. This is the communication with the sympathetic ganglia, superior subarachnoid sympathetic ganglia. This is the communication with the vagus nerve, that is the inferior ganglia of the vagus nerve. Then another communication is there with the C1. Can you see the C1 over here? Right? So this is another communication with the C1, first cervical nerve. So these are the communication 3. Now other branches are, we have the meningeal branches and we have the descending hypoglossi. Now when you trace the hypoglossal nerve below, can you see some fiber is descending down? and this is attaching with the another nerve that is known as descendant cervicalis. So this is the descendant cervicalis which is coming out from the C2 and C3, and this is the descendant hypoglossal. So this is the descendant hypoglossal which is the branch of hypoglossal nerve, and descendant hypoglossal and descendant cervicalis will form a arch. It's the round color round one also. So this is known as the ansa cervicalis. Now you will come across the word known as ansa cervicalis in the triangle of the neck. Whenever you will be reading the triangle of the neck, so at that time you will come across the word ansa cervicalis. So this is the descendant hypoglossal. Next one, we have the nerve to thyroid. Then we have a nerve to genioid and muscular branch to all the muscle of the tongue except the palatoglossal. So this is the overall branches of hypoglossal nerve. Same thing, this is the same one, right? This is the hypoglossal nerve. These are the communication of the hypoglossal nerve. This one is the descendant hypoglossal one branch, nerve to thyroid, another one, and nerve to muscle of the tongue, nerve to genioid. The next one is, this is the most important part of the hypoglossal nerve. So why I'm showing you this diagram is, so by seeing this one and the innervation of the nucleus with the muscle. So by this is the corticonuclear fiber. Your corticonuclear fiber. This one is the nucleus. This is the hypoglossal nucleus. Sorry. This one is the cortical part of the brain. This is the central gyrus, sorry, precentral gyrus. This one is the hypoglossal nucleus, right hypoglossal nucleus, and the left hypoglossal nucleus. And this one is the muscle of the tongue. So those are known as corticonuclear fiber. Our यहाँनिर लेजन भयो भने के हुन्छ, we have the upper motor neuron lesion. So यहाँनिर लेजन भयो भने we will have the lower motor neuron lesion. So before understanding upper motor neuron lesion and the lower motor neuron lesion of hypoglossal nerve, you have to remember this part. अब इसमा के भइछ, this is the hypoglossal nucleus. Can you see the lower part of the hypoglossal nucleus? This has been separated from the upper one. यसलाई किन सेपरेट गरेको भने, this is the part which is innervating the genioglossus. Okay, so this is the hypoglossal nucleus which is innervating the genioglossus. This is also the same one on the left side. Now just see this part. अब यो पार्टमा के भएको छ, this is receiving the corticonuclear fiber from the opposite side. But the upper part of the hypoglossal nerve or hypoglossal nucleus is receiving the bilateral connection from both the side. Right part in receive garesa, left part in receive garesa. Only the lower part of the hypoglossal nucleus, which is innervating the genioglossus muscle, that is receiving the bilateral connection. Not the bilateral, that is receiving the connection from the another side. Is it clear this one?
Yes, ma'am.
Now next one is, just see this one, both the nucleus, the right side of the hypoglossal nucleus is innervating the right half, and this is innervating the another half. Okay. Now see over here, whenever you have the lower motor neuron lesion, whenever you have the lesion over here, that will lead to the lower motor neuron lesion. So whenever you have the lower motor neuron lesion of the hypoglossal nerve, के हुन्छ lower motor भयो भने के हुन्छ यहाँनिर भयो भने, the muscle of the right side would get paralyzed. Our the muscle, the genioglossus muscle of the right side would get paralyzed. What is the function of the genioglossus? Genioglossus को function थाहा छ? Do you know the axon that will cause the protrusion of tongue? Now you will not be able to protrude this part of the tongue. Your part of the tongue to protrude गर्न सकिनौ किनभने genioglossus muscle of the right side has been paralyzed. That means the protrusion of this side will occur. हैन, यसको मतलब protrusion हुन्छ, यो protrude हुँदैन. As this muscle is active and this muscle has been paralyzed, the tongue will deviate towards the left side, towards the opposite side, because the muscle of the left side is active and it is pulling the tongue towards that side. बुझ्यो यो? That means whenever you have got a lower motor neuron lesion of hypoglossal nerve or hypoglossal nuclei, lower motor neuron lesion भयो भने के हुन्छ, the tongue will deviate towards the opposite side on protrusion. So what mainly you can see in this diagram also, just see over here, the patient over here, the patient is having the lower motor neuron lesion. Oh, lower motor neuron lesion. So, अब के भयो? Protrusion कुन side मा छ? Protrusion is towards the left side. That means the right genioglossus muscle has been paralyzed. The muscle of the right side has been paralyzed. Lower neuron lesion. Is it clear this one?
Yes, ma'am.
भयो अब यो upper motor neuron lesion मा sorry, lower motor neuron lesion मा बुझ्यो अब यो यहाँनिर lesion भयो भने the tongue will deviate towards the opposite side because your muscle के छ paralyzed छ, your muscle intact छ. That means there will be the pulling of the muscles towards this side. Now next one is whenever you have got the upper motor neuron lesion, अब upper motor neuron lesion भयो somewhere over here, if the left side, suppose this one, you हेरौँ न अब लेफ्ट प्रिसेन्ट्रल जाइरसमा whenever you have the lesion over there in this part, left side मा lesion छ भने के भयो, you can see the corticonuclear fiber, the innervating the lower part लाई innervate गरेछ भनेपछि यो fiber interrupt भयो. As a result, which muscle, the muscle of which side will paralyze? The left or right? Right genioglossus paralyze हुन्छ कि left paralyze हुन्छ? Hello? Hello? तिमीले सुनेको छैन मैले भनेको?
एकपल्ट भन्नु न म्याम के भन्नुभएको?
Okay, if you have lesion on the left hemisphere of your brain, then your fiber interrupt भयो. Oh, that means the right genioglossus muscle will paralyze or the left genioglossus muscle will paralyze.
Right genioglossus.
Right genioglossus muscle will paralyze because the right genioglossus muscle will receiving the corticonuclear fiber from the left side. Oh, so this side, the genioglossus muscle of the right side will paralyze. Means you paralyzed भएपछि त के भयो अब? The tongue will deviate towards the same side because the muscle of this side is active. अब यो यहाँ लेजन भयो, same side deviation भयो. यहाँ लेजन भयो, opposite side मा deviation भयो. बुझ्यो अब यो?
भयो म्याम.
बुझ्यो यो? Okay. So this is all about today's class. Sityo, this is the last one. Let's see over here. This is the lower motor neuron. Now the cortical control of the cranial nerve. So all are influenced by the corticonuclear fiber. We have the bilateral influence. So the hypoglossal nucleus, only opposite side cortical influence will be there for the genioglossus. And the facial nucleus, only opposite side for the fiber supplying the lower part of the face, and the trochlear nucleus by the same side only. So this is the cortical control of the cranial nerve. You facial nerve, hypoglossal nerve. So today's class has been finished. So if you have any question, then you can ask me. के छ सोध्नु पर्ने? Hello?